All right, cool. So good evening, everyone. Thank you so much for tuning in. This is Woke Wednesdays. We do this every single Wednesday, 9 p.m. Eastern Standard Time. My name is Hurston. I am the host of Woke Wednesdays, and tonight we have a special guest on the show, the brilliant, the beautiful Miss Talina. Thank you so much for stopping by the show.
Hi, everybody.
I want to tell the folks who you are, what you do.
Yes, again, I'm Talina. I am a mental health social worker. I currently work at a elementary school and a middle school, and I also work as a crisis stabilization screener as well. So my job, I have various roles. So I guess we can just go in order of the roles.
Not the role. Okay, go ahead. Number one. Go ahead.
Number one. As a school social worker, I see children weekly for therapeutic sessions. I also do group sessions with the kids. I do classroom presentations on bullying, prevention, and awareness, safe touches and unsafe touches for elementary school children, which is very important. I did a few of those presentations, and during that presentation, a few kids actually approached me afterwards and told me that they were being touched by family members.
Hold on. We didn't start the show yet.
Sorry.
We
Sorry.
just jumped in.
Just
jumping in.
So passionate about this.
There it is.
Ultimately, I have many roles at the school, and as a crisis screener, I assess individuals for suicidal ideation, homicidal ideation.
Well, thank you. And we're going to get into all that tonight. So tonight we're talking about children's mental health and social work. This is an area that you've been working in for a long time. Have a bachelor's in it, have a master's in it, and now you're working on your license. So you're definitely doing your thing. So please, if this is your first time tuning in, please feel free to ask questions, post comments. Talina is extremely knowledgeable. So let's jump into this. Mental health, especially within kind of Black, brown communities, not a thing that we often talk about.
Not at all.
So when was one of the first times that you kind of were made aware of what mental health was in your life? And please, you all too, please feel free to let us know when was the first time you kind of heard of mental health.
Growing up, I've never heard of the word mental health. I just would see people homeless on the street talking to themselves, and you would ask your mom, like, what's going on with that person? They was like, I don't know, honey, I don't know what's wrong with that person. They must be talking to the devil. It wasn't until my dad, he was in Gulf War, Desert Storm, and I started recognizing how he was stuck in the past. He would have always be like on high alert, very anxious. He would always say like, I could hear a roach crawling on the floor, and I would wake up, and I'm just like, what? Like, that's not normal behavior. His emotions would change. One minute he's good, one minute he's not. He would go weeks just shutting down, then weeks he's just a different person. So I noticed at a young age that something wasn't okay with my dad. And now that I'm older and he is now getting treatment, he has PTSD. He was diagnosed with PTSD. So I definitely became aware as a child about mental illness. I just couldn't call it that because I didn't know what to call it. It wasn't something that we heard.
So the experiences through your dad were some of like the awakening kind of moments.
Yeah, the awakening moment, because his mood and behaviors would affect me. It would affect me. It would make me cry. It would make me, I just would be so confused at how this person could be good one day and then the next day he's just off the chain. I didn't understand why.
So you, is that the reason that you kind of pursued a bachelor's in social work?
A number of reasons. I was a nursing major at the University of Central Florida, but then I changed it because I just wanted something else. I wasn't feeling fulfilled. I've always wanted to be in a field where I help somebody, and as a kid, like elementary, I remember people always saying, I want to talk to you for advice because you're so easy to listen to.
You are?
I mean, that's what they say.
That's what they say.
So as a young kid, I pretty much wanted to be in a field where I can help somebody. And then I come from a large family. My grandma had 18 kids, so that's a lot of personalities.
18 children?
Yeah.
She birthed 18 children.
Yeah. She was married 3 times. She wasn't out here, being a little. She was married.
Oh.
Yeah. My grandfather wanted a lot of children.
That's a lot of children though. Just like the strain you're putting on your body.
I mean, she bounced back. Though,
wow.
Like
that's
the TV
amazing.
She is.
Oh.
But having a big family, you have different personalities. And my family was not rich. My grandmother was not rich. She lived in a low-income community with drugs in the neighborhood, crime in the neighborhood. So she definitely wanted to protect her children, but she didn't really, I'm going to just say she didn't do a good job protecting them from internal factors, risk factors in the household. Because she was always at the hospital birthing a child. So there was incest, okay? There was incest, and that incest and that trauma affected a few of my family members. So a lot of trauma starts right in the household, right in your environment. That's a risk factor.
So you end up, so these kind of experiences kind of molded you to kind of pursue something in social work.
Exactly.
So then you also pursued a master's in social work, which you recently kind of finished up.
Yeah, I got my master's last year.
And the reason I'm kind of also bringing attention to this because I think it's important to see representation obviously matters. So seeing people who look like us doing their thing right academically is important, and I think is also inspiring for folks. So you did your master's, but you've been working in mental health kind of fields for a while now, right?
Yeah, for 3 years officially. I like to say that I've been in the field because of my experiences with mental health. Living in Orlando, I went to school in Orlando and I caught the bus for 2 years. I rode 4 buses daily to get to my Macy's job. And on the bus, I would come into contact with people all the time battling mental illness. I just didn't, I didn't have the knowledge fully that I have now. But people would be hallucinating. They would be having auditory hallucinations, visual, even tactile hallucinations, which is thinking that something is in your hand. I would see that. People would be on the bus using drugs. I would see so many issues on the bus, and I actually started writing like a short story called Get Me Off This Damn Bus because it was just so much. It was so much. So I really feel like I was being prepared during that time to work in the field now.
So now you work specifically with children.
And adults.
And adults too.
And adults, yeah.
But you also work in a school, right? So when we think of children's mental health, we've never talked about this on the show. We've talked about mental health, but not with children specifically. What are some of the things that you kind of see that lead to children kind of battling with illnesses, just mental illnesses?
Okay, so I'm going to start from the beginning. Socioeconomic status. Where you live plays a major role in the traumas that sometimes we experience being minorities, being raised in these areas. The school that I work in Florida City is a low-income community, and it's also a heavily populated migrant community. So we have to start understanding that children who live in these environments, all the psychological stress, they bring it to school with them. And children don't know how to cope. Like we as adults, when we're stressed out, we might drink, we might spend recklessly, we may gamble. Children, if they're not going to self-medicate, they're going to act up in school. So when they go into the classroom, the teachers are always saying, this is a bad kid. They're always being bad in my class. You have to explore why this child is being quote unquote bad. What's going on at home? So I always have to preach this to the teachers. I also have to talk to the parents and let the parents know, like, listen, talk to your children because they're always seeking validation from other people at school. And your children at this age, especially middle school, I have a caseload of about 40 kids and I still have not been able to see the rest of my load.
40 children?
Yeah, because I have to get parental consent to talk to the children. So I have like a stack, but I've seen about 40. And I provide the sessions weekly and going to the classrooms and everything, but it's not enough. In this field, I sometimes feel like it's not enough because at school, I'm their support system. They come to me when they have issues and talk to me about anything. They give me all the tea. And then they go home and they're back in their trauma-filled environment. That's not effective. It's a revolving door. It's just gonna, that's how I feel sometimes.
So in many ways, you're almost barely a Band-Aid on a bullet wound.
Exactly. And it takes a team of people to help these children, and your environment has to be a positive one, but there's so many risk factors. I had a kid who, again, is a quote-unquote bad kid. The teachers are like, oh, Miss T, this kid is so horrible. She's so bad. Get her out of my class. I'm talking to her, and we discover that her mother was shot on Sunday. This is Monday. Her mother was shot the day before. She was there. She witnessed that in a drive-by shooting. Her mother didn't die, but it's still, she saw the blood. She felt the emotion. She was suffering from nightmares. She was suffering from anxiety, all of these things. And all she knew how to do was act out with anger and rage. So children, a lot of times, they're misdiagnosed with all these behavior issues and emotional disorders, but sometimes it's just depression. It's just depression. It's not conduct disorder. It's just depression. It's not that they're bad kids. It's just depressed.
But I think you said something brilliant earlier that adults will self-medicate in many, unhealthy ways, but some healthy. But the point is that they self-medicate.
Mm-hmm.
But children end up just kind of acting out or misbehaving. And what we're saying here is that you had a child who witnessed her mother an attempted murder on her mother, and she's been deemed as a bad kid. So the teacher just didn't ask anything, so they kind of left it on you to also just ask.
Yeah, I try to look at it, look at the entire picture, right? Teachers are stressed out. Some of the teachers, they come into the health suite because I also work with a nurse, and they're always checking their blood pressure every day, checking their blood pressure. They're stressed out,
Teachers.
and rightfully so. Yes, the teachers. They are stressed out. Some of the teachers are receiving therapeutic services. Sometimes I refer them to CHI where I work for help because they're stressed out. The children, they don't listen, and it's tough. You want them to listen. You want to teach because you have to do a job, but they're constantly cussing you out. They're constantly fighting. I mean, there was a fight today. It was a fight yesterday. It's always something. And a lot of these fights stem from social media. That's another problem, I have to say. This generation, middle school, social media, like during our time, we didn't have, in middle school, there was no social media. But a lot of problems derive from social media, and they bring it to school to try to solve it. I noticed that.
So you're saying this is kind of like a new kind of occurrence with children?
Cyberbullying, yeah. It's a daily occurrence. And it's another thing, again, the environment where I work, right? There's no programs. There's no home ec. There's no dance. There's no chorus, band, drama, none of that. So you have these children, and they're just taking all these remedial classes because they failed the FSA, which FSA was this week, and they're nervous, and that's another
FSA
thing.
is like a...
Like the FCAT. Like,
okay.
You know how we had the FCAT?
Yeah.
So they're testing.
Like a standardized test.
Exactly.
Yeah.
Where they, you have to pass to get to the next grade level. So all these risk factors, basically. And the children cannot focus. They don't have anything to keep them focused, to keep them entertained, because all the programs were taken out. So I talked to the assistant principal, and she told me they're trying to get some programs back because the district came to the school, did some interviews, and they're trying to understand what would keep the children entertained. But they need something, because guess what happens? They go on social media, and then they're fighting. And I'm talking, so-and-so said I look like an owl, miss. I want to fight them.
An owl?
Yes.
Okay.
Or someone's in class and they draw a picture of an ugly monkey or something on the left side, and they post another one of the girl on the right, or they're calling this girl a hoe, and it's always something that derives from social media, and then they bring it to school to try to fight to solve it.
And all this is affecting children's just mental health.
The bullying, because like I tell the kids, you don't know what people are going through at home, right? You don't know what they're going through. And then when they come to school, if you're bullying them, that's just another extra layer of hurt. I have another kid. The teachers wanted to kick him out of school kick him out of class.
What grade is this?
This is middle school. So
middle school,
6th grade, 7th grade, 8th grade. But I had another kid. He lived in a homeless shelter, and the teachers were trying to understand why he's always falling asleep in my class. Why is he always falling asleep?
A middle school child living in a homeless shelter.
Him and his family. And he was like, Miss, I don't sleep at night because it's hot at the homeless shelter. I said, so when you come to school, it's cool, it's cold, and it's comfortable. But the teachers are so busy trying to teach that sometimes they don't recognize these issues in their classroom with these students.
And part of what you're saying is we're not putting blame on the teachers, but we're also saying that these students and children there's a context to them that oftentimes we just don't know about, or don't acknowledge, don't ask about.
Yeah.
And all this stuff is affecting them mentally, physically.
Yes.
So what are some things, like the life, like just a day in the life? Because you do a lot. You work in the schools, but you also work at a CHI. That's what is it?
Crisis unit.
Crisis unit.
Yeah.
So in the crisis unit, you work with both adults
and children.
So what are a day in the life of someone who works in mental health?
Okay, so let's pretend it's a Friday. I work Friday coming up, so every Friday, every full moon, it's just hectic. So I'm doing a double. That's 12 hours. I go to the school. I work at the middle school. Sometimes I get approached by the principal. Talina, Miss McGee, can you talk to this student? She cut herself. And I'm not talking a regular cut. This is a true story, a deep laceration. Now, she has a history of cutting herself. And when children cut, they're not cutting because they're suicidal. They're cutting because they're trying to release whatever pain that they're feeling internally. That's what they're doing. But she cut very deep. So I'm talking to her, trying to understand, why did you cut yourself? What's going on? We already know her trauma. She was molested by her brother, so she's dealing with that trauma, and she's only 12. So we're exploring that, and we're trying to call her mom to get the mom to come out there. That's what I do. I contact the parents, let them know what's going on. Had to partner with the police, the school police, to let the school police know this is her trauma, this is what's going on. Call CHI, let them know, hey, she's coming over to the crisis unit because I work there. I have a good connection. So that's one aspect of it. Then maybe there's a fight going on with another student of mine that I see. So I have to tell the school staff, oh, this kid, I've been seeing them. This is what we've been talking about. Well, they did say so-and-so has been bullying them. Maybe that's why this situation occurred. Or they did start taking Risperdal medication, and maybe this is why they're acting the way in which they're acting. So I have a close relationship with school administration, teachers, and students at the school. That's what life looks like as a school social worker. Sometimes I do interventions and little activities with my elementary kids, and this is basically a little intervention where we talk about feelings and emotions. Now, children, and I started doing this with middle school as well, children may not be able to verbalize how they feel. It might not be easy for them just to be like, well, I'm sad because blah, 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 blah. No, let's do an activity where I can actually see what it is that you're internalizing. So I tell them, okay, this is your heart and this is what we feel. Everyone has emotions, we all have feelings, and it's normal. So I want you to pick some colors and you tell me which emotion represents that color, and I want you to shade in how much of that emotion that you're feeling here. How much happiness, how much sadness. This was done by a first grader. He's 7 years old. And
so real quick. So you kind of researched this activity, you kind of came up with it, and then you wrote in the emotions on the left. So do you mind if we just show it up real quick? So this is the activity. And to read, you have here the emotions are happy, sad, scared, nervous, confused, and guilty. Right? So could you walk us through it a little bit?
So basically, the student I said, well, tell me how much happiness you're feeling right now at this moment. And he colored in yellow for happy, then for sad, he colored in the blue. Then he has here scared in the middle, confused down here, nervous, and guilty. So I wanted to explore. This is my last session with him, by the way. I do 5 at the most, 10 depending on the issue. With my elementary,
5 sessions with each student?
With each student, weekly. Depending on the issue. If it's something severe, I'll extend it and then I'll refer them out to get some in-home therapy or outside therapy.
So all this therapy is also going on during school?
Yeah.
So they're also being taken out of the classroom?
Yeah, for 30 minutes. But the teachers know who I am, the staff know who I am. If I'm taking the kid out, it's for a good reason. It's for a very, very good reason. And I think it's important to understand, I always tell the teachers, please don't always refer the super, super emotional, like the serious issues to me, because I want to be able to get to the children who may be hiding, who may have some issues that I need to really, really dig through. Maybe,
So where do the more emotional children go to?
They send them all to me. I mean, there's a school counselor as well, and there's actually 2 school counselors, but they always refer to me because they know, okay, they know what I do. They know I work with CHI. They know I work with these severe mental illnesses.
But I guess what I'm asking for, like the more emotional children, there is a place where they can go to. No?
No, I mean, financially, parents may not have the money for therapy, right?
I'm talking about at the school, so not even with the counselors.
Because they're busy. Like right now, it's testing, right? So they're proctoring the exams and everything. The counselors don't even have time.
So basically, we just don't have currently we don't have resources in schools.
Not enough, because there's me, and there's one of me. It's this program was established after Marjorie Stoneman. After that happened, a grant was
the shooting at Parkland.
Exactly, the shooting at Parkland, and that's
really
this is one of the reasons why this grant got created. So CHI operates on a bunch of grants. So I'm working on a 5-year grant. It's going to get extended. So the goal is for them to implement more mental health professionals in the school. That's what the goal is.
Okay.
Yeah. So back to this. He was able to tell me why he felt guilty, why he felt sad, and we were able to explore that in a way that made it simple for him.
So before the show, we're kind of talking about this student as well. You're saying this student is very smart, and they know they're only 7 years old. I think you said.
Yeah, he's only 7.
So, like, how did So as a mental health professional, how are you then analyzing this 7-year-old child? Like, how are you kind of making sense of things, and what is kind of like the protocol?
So when you're working with adults, you do a treatment plan, right? You try to figure out what the problem is, how long they've been experiencing the problem. A child may not come out and tell you that. So I have to talk to the teachers and see what's going on, how is the student behaving in class, talk to the parents, how is the student behaving in class, and then I start utilizing some interventions and strategies that I think might help with this child. So if they just, for instance, lost a grandparent, which I've had some kids lose a grandparent, I'll do different grief activities. I'll have them write out all the things that they miss about this person in their life. Then we'll fold it up and put it in a balloon and blow it away. Things like that to make it easy for them to cope. I'm trying to think of some other interventions that I do. Oh, Candyland. I do a feelings Candyland game where if you land on a color, you have to tell me about a time you've been sad, a time you've been happy. So I try to make it where they open up to me and I can go from there.
So now the opening up is like a big part of being a mental health professional, right? Getting people to open up to you is part of the job. And I can imagine that it can be very difficult.
It can be.
Too. So what do you say, like, when a child tells you something that's so horrible? How do you even begin to work through that?
Well, first of all, you have to be empathetic. And we were talking about that earlier. There's a big difference in being sympathetic and empathetic. Sympathy is more like trying to paint this pretty picture, like, well, it could be worse. It could be worse. Well, at least this didn't happen. That's not showing that you really understand what that person is going through. But to be empathetic, you might cry with that person. Not that I have, because in this field, you want to make the person feel empowered. You want to try to refrain from them seeing you cry, because they're like, you crying, how you gonna help me, right? But you need to be able to hold their hand, comfort them, and say, you know what, I have never experienced what you're going through, but you can get through this. You don't have to keep making the same horrible decisions just because you were raped. I had to tell someone this on Sunday. She's another cutter, 16 years old, raped by her father, and she was like, miss, you know I told you I was raped. I was like, yeah, but you dropping out of school, why? Your grandma is there supporting you. She's doing everything that she can, but she was Baker acted about 10 times. Now, Baker Act is when someone is suicidal or homicidal with a plan and intent, and they may be potentially harmful to themselves or other people. So the police can come in and take you to a crisis unit, like where I work.
So that is very. It's hard. I'm not a mental health specialist, but it's hard, like, to think through. So when this person is saying, "Hey, I was sexually assaulted,"
by their dad,
by their father,
yeah. All you can do is listen to their story. Like I always tell people, these kids have a story. Every child I've ever interacted with, or adult, they've left an impression on me. And their stories are some of the most heartbreaking stories ever. There is a stigma. Like we were talking earlier about the stigma and how a lot of, in the Black community, there's a cultural stigma and a spiritual stigma. How do you tell someone who was raped by a pastor at their church to pray about it? You can't simply just tell them to just pray about it. But this is what another kid told me. I was raped by the pastor at my grandmother's church. Then she started prostituting. Then she started using coke. And then she started using heroin. Then she started getting back alley abortions. I can't sit there and just tell her, oh, just pray about it. No, I have to be able to direct her to someone who can really help her. I got to be able to show her that there's a different way. But again, when I hear these stories, all I can do is make sure that I empower whoever's in front of me, empower them as best as I can.
Now you also have situations where sometimes you might only see a person like maybe once or twice, and they still kind of leave an impact on you.
Oh, a lasting impact. A student. I'm gonna try to not make this too long because it's a hefty story. But she was out of school for a year because she had some trauma. She was raped, and she was raped on Instagram live by a man and a woman. And that really, of course, that damaged her. That's traumatic. So she ran away, and she was out of school for a year. So she eventually ended up being in foster care, and she was supposed to finish out 1 year of school so that she can go back to her home, to be with her family. And I feel like the system set her up for failure, because if you know anything about trauma, you know that you can't put a person in a situation where they can be reminded of that trauma. So she basically would walk in the morning to school, and she would be having anxiety and anticipating what's going to happen, like how she felt when she was abducted in the back of that car. So walking to school, she's, anxious. So what does she do? She runs away. And I've been working with her for 2 days, eating lunch with her, talking to her, introducing her to her classes, introducing her to other students, trying to get her a strong support system, letting her know that we're here. We did some journaling activities and everything. I was really trying my best to get through to her and help her adjust to this situation. And because she ran away, they ended up taking her out of the school. They didn't even tell me. I had to keep calling, and I found out. They took her out of school, and she's going to another school somewhere. I don't even know. But that was one that I felt like I didn't have control over. And she had not only been raped, she suffered from seeing a family member get shot in the head. She was there. She had the responsibilities of her young brothers and sisters when her mom was out on the street doing drugs. So this is someone with a lot of trauma. A lot.
Yeah, a lot of this goes back to the socioeconomic status that you were talking about earlier. A lot of these children, we're saying that they're vulnerable already.
Yeah.
But when they're poor children, it makes them even more vulnerable. So what do you do in a situation where a child opens up this much? How do you even begin to kind of address this? Because I don't even know what to say to it.
Well, with her, I showed her my actions, right? I went to lunch with her every day because this was a new environment. You got to realize she wasn't in school for a whole year. That cafeteria at the middle school is like a jungle. It's a zoo. So I recognize that she's suffering from PTSD. Let me go and eat lunch with her, me and her, so we can talk and just talk about whatever she wants to talk about. And she went into details about how her name even came to be. And to have a parent to tell you the reason why you were named what you were named. I'm not going to give her name due to confidentiality, but basically the mother implanted negativity in her life from day one. Because you don't tell a child that I thought about giving you up for adoption, but then I saw you and I changed my mind, so I named you what I named you. So that's setting you up from day one. You're feeling like you're worthless. You're feeling like you're hopeless. So you have to live the rest of your life feeling that way. And then when you tell people you were raped, no one believes you. No one believes you. And you continue to feel hopeless and worthless. And this is a 13-year-old we're talking about. I wanted to read what she wrote, but I don't know if we have time.
Please feel free to.
Because I'm an artist, she's an artist as well. So we explored our artistry together. I let her read some of my things that I wrote. She let me read some of the things that she wrote. And it left a lasting impression on me. Hold on.
So again, if you're just not tuning in, we're talking about children's mental health and social work. Please feel free to post comments and ask questions if you have anything. And Talena's about to read something that her student wrote.
Yes. She wrote, I know I made some mistakes, but that was all in my past. How I'm out here trying to regain my grounds real fast. And I don't understand the pain. I don't understand the struggle. I don't understand why all of this is running through my brain and running through my veins. And I feel like I can't escape. And even when I try to overcome all the hate, it feels like I'm sorry, kids, they write crazy. I just get locked in tighter and tighter in this gate. And my heart is begging to break. No matter what I do, I know I can't prevail. Before I even started, I already knew I failed. And in case you didn't know, my life is like a sail, and it just started sinking. Do I revert to drinking or do I revert to prayers? Because even though I pray, my life still is in despair. Man, this life really ain't fair. But you don't care, huh? You don't care that my life is a sail. Where is my life going? Where is it flowing? Because I think I'm out and I don't feel anything. And we call that feeling lifeless. Well, I don't feel a thing. I just keep feeling empty at heart.
Wow.
Yeah. A 13-year-old.
Wow. I don't have any words. I don't even know what to say.
But again, you see what I'm saying? Like, how can a child that's suffering that much trauma come and sit down in your classroom and learn about this watered down history, or learning about the Pythagorean theorem that you're never going to use? How are they going to learn about that? Why would they want to learn about that when they have so much real stuff going on?
Absolutely. I don't know what to say. But I remember you telling me this story initially, and I couldn't sleep that whole night. Right, I just kept on thinking about this little girl and everything she'd gone through, and that's just you telling me that about the story about one child.
Just one.
And this happens. It's an epidemic. It happens just everywhere, all over the world, constantly happening. It's happening right now. How do you? Because part of this is interacting with the children, talking with them through their traumas, addressing their mental health. But then how do you also kind of try to stay sane?
Mm-hmm. Well, singing, like, me and you do our jam sessions, that's therapy for me. Traveling, I just got back from Dubai not too long ago. That is the ultimate self-care practices. Sometimes just going to bed early and sleeping in, or staying home all day in my PJs and Netflix and chill and some good old wine. That's how I practice self-care. Being around my family, talking about it like now. If I held everything inside of me, I think I would break. But I have family. Now I have this as an outlet. I do presentations sometimes about mental health, just educating people about the importance of it, because I think we put so much emphasis on physical health that we neglect our mental. It's always, let's go to the doctor to get, blood pressure, this. But just like diabetes, just like eye problems, just like heart problems, mental health is a problem. It's a sickness, and it has to be addressed. So for me, I realized that I had to make sure I don't burn out. Because if I'm no good, I can't be good for any of these kids or anybody that I work with.
So let me ask you this too. As a mental health professional, then how do you feel when people go to another person and then they try to offer advice, but they're not a mental health professional? Because you see a lot of folks who are professional advice givers, but they don't have this training. So what are your kind of ideas on that? Because I see it happen all the time. And
with who in particular?
Well, mental health is a stigma, right? Going to see a therapist is stigmatized. People don't like to talk about it. They don't like to do it. So they prefer maybe just to go to a friend they might feel more comfortable with. So I guess what I'm trying to say is that to encourage folks to go see someone if they have the access to.
If you have the access. Please go and talk to a mental health professional, a therapist, a licensed clinical social worker, preferably someone who is culturally competent. That means someone who understands you, understands your struggle and what you're going through and the stigma surrounding mental health. Black folks don't believe in mental health. They believe we can pray that thing out, oil it out. The mothers in the church gonna get the sheets. We gonna get that spirit out of you. They don't believe in going to seek help. They think you're weak sometimes if you seek help from outside sources, but that doesn't make you weak. I've had people tell me all the time, like during my practicum, you know what, I'm so glad I talked to you. I feel so good because I couldn't talk to my family. They judged me. They thought I was weak. They thought, you know what, you just tripping. It ain't nothing wrong with you. You're not depressed.
So let me ask you this then, because talking about cultural competency, you were saying earlier before the show that people have been misdiagnosed because the doctor was culturally incompetent. So can you talk a little bit about that?
So African Americans are more likely to be diagnosed with schizophrenia than any other race. And that is because a lot of times these psychologists, and I know from experience because, again, I work at CHI for 3 years. I worked as a physician assistant specialist at one point, and they have 40, 50 patients who they're seeing back to back to back to back, diagnosing them quickly and giving them medication. So how can you give an accurate diagnosis if you're only talking to your patient for 5 minutes? If they're telling you they talk to the Lord and they talk to the Holy Spirit and they believe in the devil, you can't chalk that off as schizophrenia. That's culturally what we as a people do. How is that schizophrenia? So then this person gets prescribed alazapram or clonidine or something like that, an antipsychotic, and then they start taking it. Now you have to explore now it's affecting your brain and it's affecting your physical because you don't know what you're taking. You're taking an antipsychotic. That means it's going to decrease the frequency of hallucinations that you have, voices that you hear. But someone who isn't schizophrenic, maybe they're just paranoid because they live in the hood and they hear shootings all the time. There's police brutality in the community. Or maybe this person witnessed their loved one being deported. Now they're nervous that they're going to be deported now. I had clients who didn't want to get free stuff when I worked in the other program. We were giving out free book bags and food, but she was so nervous and she was afraid that she was going to get deported. So you're dealing with people who suffering from trauma, PTSD symptoms, maybe clinical depression, not schizophrenia, but we're being misdiagnosed. So you have to challenge your provider now.
And part of this, what you're saying too, is that you're kind of also tying racial identity, ethnicity, into all of this. So what role do you think, you being a black woman, how do you think that plays a role in the work that you do?
I think it's inspiring.
There's like 4 of y'all.
Yeah.
Yeah. Like.
Well, for the school program, the grant in which I work for, many of us we're Latino and African American. It's about 10 of us actually. We're in different schools, Latino and African American, which is important because representation matters, right? I'm not throwing shade to any other therapist who is not African American or Latino. I just feel like it's important for you to be culturally sensitive and aware. If you're going to be working in a population that is diverse, you need to make sure that you have training or you've taken some courses on being culturally competent and sensitive. You have to be. So I think I have, I noticed that children love to ask me, like, what is it that you do? They think I'm a nurse because I'm in the suite with the nurse. I love to tell them what I do. I love to see the enthusiasm on their face because I encourage black women and people in general to get that master's in social work. We need more social workers out in the field doing the work, putting in the work. It's important for me as a black woman to make sure I encourage other black women to come on, be a social worker. We're not just taking kids away. That's not what we do. But there's a stigma behind social workers. They think we take kids away. We don't take kids away.
You're saying that's more what the
case managers, DCF. But me, I'm not going to your house and taking your kid away. That's not what I do.
But also, just kind of speaking about racial identity and you being a black woman in relation to what you do, you were saying, I think before the show too, that someone opened up to you saying, "Hey, thank you so much for you being here," just thanking you for your very presence, because there is something about having that cultural knowledge, cultural competency that is so important. You could literally be saving somebody's life by having this type of cultural competence. So, like, how have you also seen that play a role working with children? With
children in the schools, I think when people see me, they think I'm young. First of all, they think I'm like, they think I'm really young. They think I'm like a middle schooler sometimes. Okay. But when they find out my age, how long I've been in the field, and my experience, they embrace me. They love on me, and they tell me how much I'm appreciated. Sometimes I don't feel like I'm worthy, being honest. Sometimes I feel like it's a revolving door. I feel like no matter what I do, the kids are going to go home and continue to be in these traumatic situations, and they're going to come and talk to me for 30 minutes, because I can only have them out of class for 30 minutes, okay? In 30 minutes, it's like we're having a big sister, little brother, or big sister, little sister talk. We're doing things. We're talking about what's going on with them. Sometimes I'm the only one that talks to them. At home, they don't have this support. But then what do you do when they go back home? Sometimes I feel unworthy. I feel like giving up. But then I'm reminded when people embrace me at the school, when the kids embrace me, when the kids come and give me hugs, I realize then that I got to keep going.
Do you feel like in those 30 minutes it's just too rushed, too sometimes?
Too what?
Too rushed.
Too rushed?
Because 30 minutes to me sounds like nothing.
That's how I feel. But it depends. I make the most of the session. I cater it uniquely to every kid that I'm with. No kids interventions, no kids session is the same. I cater it towards whatever they like, whatever they want to talk about. I have some kids who at first they shut down the first session, then the next session they open up. But during that time, I make sure that I explore what's going on. I had a kid whose grandmother had set her up to get beat up by some other girls because of
her grandmother set her up.
Yeah, I can't make this up. I can't make it up. A video has circulated around the school of her participating in some sexual activity. She's 12. The grandma found out about it, and she solicited these high school girls to bully her granddaughter and try to beat her up. And I saw the video, and then I called DCF because that's a problem. And ever since I called DCF and I followed up with my kid, everything has been wonderful at home now. But this is another kid with trauma. Her mother passed away from breast cancer. That was her major support system. Her dad is on drugs. She doesn't even really know grandma. This is her dad's mother. But that's what grandma did. And I then called DCF because that was a problem.
You literally cannot make this stuff
I can't make it up. I could go on and on and on and on. I could talk all night about the stories. But what I love to tell people is that these children have a story. They've been experiencing things that some of us have never had to experience. Never. So this generation is very unique because they're growing up in situations that are just, you feel hopeless. You feel like you want to take them all home. Like sometimes I feel like putting them all in my little four-door car and taking them all home with me. Just come home with me, but that's not the reality. It's not.
It kind of goes back to something we were talking about how children don't often get to be children, and they're stripped of their humanity. It's like we said, children are already vulnerable.
Oh yeah.
But when these are poor children, when they're children of color, immigrant status, all this stuff comes into play, and they become even more vulnerable. And one thing that you've said to me a lot, just kind of off air, is that a lot of these children, all these children are so smart, so smart, so just like good children.
Good children.
But it's the situations that they've been put
situations. It makes them. Obviously, they're going to act out. They're going to have behavioral issues, emotional issues. But I never want to hear an adult call a child a bad child. Because bad children just don't exist. What happens is they're bad and effed up situations. That's what happens. I had another kid. Oh, God, another kid. She randomly asked me, Miss, what's that drug called that you use with a needle? What 11-year-old is going to ask you that? So immediately I stopped typing. And she's not even one of my kids. She just always says hi to me, so I knew her. I was like, well, what did you mean? Why did you ask? Oh, nothing. I said, oh, something. Why are you asking me? I said, that's heroin. Why are you asking me about that? She said, because I saw my mom on the toilet shooting it up. This is real life. This is what these kids are going through at home. But they have to come to school and take this stupid FSA and learn this stupid Pythagorean theorem and pi and all that crap that they're not going to use. Meanwhile, they just saw their mom on the toilet shooting up heroin. That's traumatic.
Real quick, Eileen is saying that's a pet peeve of hers where she's like, these are not bad children.
Exactly. It's not bad children. It's not. I hate when teachers say it.
And I'm glad we're addressing this because this is one of the, I think, very difficult things for folks to oftentimes understand about how systemic racism and systemic classism and just all these things work. Is that you have children, right? These are innocent children, and they're birthed into situations with parents who also have their own traumas, their own shit that they're dealing with, and then these children might grow up, might end up going to jail, might end up doing all these things, but there is a story to this, there's a context to this that is, if they were born in a different place, in a different setting with different resources, maybe they wouldn't be doing this.
Maybe they wouldn't. Maybe if someone gave a damn about the condition of the schools and the environment, maybe it would be maybe if there was access to more mental health resources where you didn't have to worry about, I don't have insurance. Come on, if there's something going on, you should be able to get free counseling somewhere.
Absolutely. And when we talk about like free health care, which a lot of folks in this country are actually against, which makes literally no sense. In places like Argentina, like places like Sweden, Denmark, like healthcare is for everybody, and mental health is a lot less stigmatized. People in Argentina just go, hey, I'm going to my therapist. Cool, we'll see you later. It's a thing. Like, this is normal. This is a good thing. But when you live in such horrible situations, it seems like a luxury. And luckily they have people like you in the schools. But one thing that you said that is very important is that there's you and there's 2 counselors for an entire school. How many children are there? Like over 100?
Oh yeah, maybe 300, 400. And they all have issues, especially the 6th graders. That's that transition from going to 5th grade into 6th grade. It's like a many issues. they're seeking validation from other kids. It's just like they have so many behavior issues, the sixth graders. I can't put my finger on it.
You know, black boys and brown boys are the number one just suspended kids in middle school, high school. And I
talk to them like they're my little brother. Like I have one, he's again another smart one, but he's always getting into trouble, always. And I'm like, and I tell them straight up, yo, you're a black boy. You can't be doing this stuff. You're walking around with the ankle bracelet on and you're only 12. What do you think is going to happen next? But then he's on medication, ADHD medication, which is another issue because black and brown children are diagnosed with ADHD frequently. And sometimes they shouldn't be taking medication. They just shouldn't be. They need to learn how to cope. A lot of things you just need to learn how to cope, learn how to deal with it, and not resort to medication. Because medication is like putting a Band-Aid on a wound. It's not, to me, it's not a solution. I feel like if you were diagnosed with schizophrenia and you need to, maybe get these voices decreased and you need to be able to function, I can understand it. But a child, ADHD, taking medication because you can't calm down. Like when we were kids, we went outside and we played. That's how we dealt with ADHD. But the problem is now ass whipping, yeah, like sit your ass down. But nowadays, like these children are overly diagnosed with ADHD and they're all on medications, and it's not healthy.
And this is the state of children right now. And I'm thank you so much for sharing all this. We're actually like running out of time. Thank you so much for sharing all this because I think we tend to think about children kind of like in the abstract. Kids, like they're this, they're that. But we rarely get to humanize children that have been deemed as bad kids, who are poor, who are coming from these marginalized communities. Mm-hmm. So in many ways, everything that you've said tonight has helped humanize these children, which is extremely important. Let me see, we have a comment here from Eileen. I work at Jose de Diego Middle School, and there's only one counselor and a part-time social worker who is there only on certain days. It's just too much for one person.
It is too much for one person. I'm at my middle school 3 days a week, and I still feel like it's not enough. I feel like it's not enough. I'm at my elementary school 2 days a week. But on the days that I'm not there, so much has happened. I mean, children have been Baker acted, taken in, the school police taking it.
Children being Baker acted.
Yeah, and see, because I work in the crisis unit, there's a direct from the school to prison pipeline. That's what's happening.
That's a whole nother.
That's what's going on in school. So I'm constantly fighting this good fight, as Mr. Bullard says, doing the people's work, fighting this good fight, always advocating for these children in schools. I'm trying.
We need more. We need so many things.
We do.
So many, and all these things can be avoided. Mm-hmm. That's the thing. Like if we, this is a whole nother just. Another man.
But you know the saying back in the day is children should be seen and not heard. Oh God, that's a horrible way to think that children should be seen and not heard. Children have a voice, and children should be able to use that voice. They should be able to use it. But they're especially black boys. They're taught to man up, don't cry. That's weak, and that's how you have all these other behavioral and emotional disorders in schools with these children.
So sometimes what you're saying too is that we kind of create these problems like unintentionally.
We do unintentionally create these problems within our communities sometimes.
Oh my gosh.
Man up, like what?
Dr. Rosalas Mesa is saying, amen, I'm there with you. X Laura Vasquez is saying, I was thinking of becoming a social worker, and this is motivating me. I wasn't sure before, but now I am.
Oh, that makes my heart. I just told you that, right?
Yeah.
I just told you, if I can't do anything else, I want to encourage people to be a social worker. Research what it is that we do. We do everything. We advocate on a micro level, on a macro level. We advocate policies and change. We advocate for these children, and you are important. You feel like you're making a difference. Even sometimes if you go home and you feel like, fuck, I don't know what just happened. I don't think I did. You get reassured daily that you are important. Please do it. I'm working on my license now because there's so much to learn. Every day I'm learning something new, but please, we need more social workers.
And X Laura Vasquez, please feel free to follow. Is it okay to follow you on Instagram?
Of course.
Please feel free to follow Talina. I tagged her in the promo video for today, so please feel free to follow her. And if y'all live in Miami, we're gonna be performing tomorrow night at an open mic in Alapata. So if y'all live in Miami, please let me know. I can send. I've been posting the flyer on the Instagram story all week. Dr. Rosola's message real quick. She said we need to decolonize our parenting. Liberation starts with our babies. The way we were raised stems from colonialism. We oppress our own children.
Oh yeah.
So yeah, so that made my night. That comment
it did. That comment that really made me feel good.
But if there were some parting words that you could kind of leave us with in relation to children's mental health, what do you think? What do you think it would be?
I'm gonna say what I just told my friend the other day, who texted me and asked me to speak to her daughter, and I volunteered to pick her up, and I took her to get some ice cream and some pizza, and we did that same activity with the heart. Talk to children. Talk to any child that you see that may be looking disconnected, or even if they look happy, just talk to them, because at home their parents might not have the time to talk to them. They might be working, it may be a single mother. Talk to children, and remember that every child has a story. You never know what they're going through. Trauma begins in childhood, and it sometimes goes into adulthood and becomes worse if it's not addressed during childhood. Talk to the children in your life. Talk to them.
Absolutely. You know, thank you so much for saying that too. I don't know if any of y'all watched the R. Kelly documentary, but R. Kelly, we tend to kind of judge him as an adult now. But what a lot of people didn't know is that he was sexually assaulted by family members as a child. Most people who go on to commit sexual assaults were themselves assaulted.
Yeah.
So you're absolutely right. Like, this trauma, that it starts in childhood.
It does. And I'll be transparent. I was, touched by a cousin when I was a child, when I was 5 and again at 11. And I had to deal with, his mother not believing me. When she had her own trauma from incest. So all of this is a problem. We have to be able to talk. We have to be able to have open, honest conversations about what's going on, especially with children, because they may be scared. I know I was scared. I was scared to tell my mom that her favorite nephew had did what he did. I thought I was going to ruin the family. But we have to be able to talk to kids and encourage them to speak up about whatever is going on, because they will suppress it and they will not tell you. They'll tell their friends before they tell you.
Thank you so much for sharing that. Because I think when we think about strength, people think about it as this like kind of physical kind of prowess. But that what you just did, it takes a lot of strength and courage. So thank you so much for sharing that. And I believe our stories can also help liberate other people. Real quick, let me read some of these comments. Dr. Rosa saying there's no such thing as other people's children. Yeah, protect children. Probably he kind of saying kids are cutting themselves down. This is something that you talked about.
I see it daily.
Fab's daughter saying you're so strong, talking to you. And Ex-Lover Vasquez is saying agreed. I try hard to talk to my little cousins because I want them to confide in me, and they have so far. I'm just glad I'm able to be there for them. Yeah. So much to talk about regarding this. But thank you so much for being here, for being vulnerable, for being strong, for being amazing and brilliant, and being the person that you are.
Thank you.
Y'all, she's super talented too. Follow her Instagram page. She's a singer, amazing. She has awesome clips of her on her Instagram page. Feel free to follow her. We'll be performing tomorrow night here in Miami, Florida. If you do live here, feel free to come out. But thank you so much for being here.
Thank you.
Thank y'all for tuning in, and we'll see y'all next week.
Next week.